Now the mammary glands. Please note that the mammary glands are found in both males and females. They do not develop, though, um, except for under the influence of estrogen. But again, these are accessory organs that are found in both the male and the female reproductive system. We're going to discuss them, though, in the terms of the female reproductive system, where they do actually develop. These are specialized glands that secrete milk following pregnancy. They are found in the subcutaneous tissue, so there's your skin, there is the fat or the subcutaneous fat, and it is totally separated from the muscle underneath it, which is the pectoralis major muscle. The pectoralis major muscle is covered, just like any other muscle, by fascia that separates it from the breast tissue. One of the signs of breast cancer would be that the cancer invades the pectoralis major and leads and becomes fixed. So normally the breast tissue is mobile and it is not attached to the deeper muscle. But again, one of the red flags that would definitely need further investigation would be to find that the mammary tissue is now attached to the underlying muscle tissue. Again, both males and females have mammary glands. As puberty reaches, though, the ovarian hormones, the estrogen and progesterone, lead to the development of the tissues. On the skin on the outside, there's a nipple in the middle, and that you'll find that the ducts open up in the nipple and surrounded by a darker or pigmented part of the skin known as the areola. If you look at the mammary glands, the mammary gland is made out of 15 to 20 irregularly shaped lobes, and each lobe has what are known as alveolar glands. These glands are going to drain into alveolar ducts that eventually drain into these lactiferous ducts. Those lactiferous ducts again open up at the nipple. There are strands of connective tissue that are known as the suspensory ligaments that support the breast tissue. So you'll find the suspensory ligaments that again go from the breast tissue towards the skin, and those are there in order to support the breast tissue. Now, in cases of breast cancer, so what are other red flags that there might be breast cancer involved? For example, thickened tissue over the breast. So you want to look at the skin covering the breast. There could be dimples. There could be change in contour. There could be change in the shape or the direction of the nipple. There could be nipple discharge. Again, just different things that would warrant further investigation. You would do a biopsy in order to confirm. And the different surgical options out there, there is a lumpectomy, which is the surgical removal of the breast lump. That would be in cases where the tumor is still local, no invasion to the surrounding tissue. But if there is invasion of the surrounding tissue, we want to take a more aggressive approach. So a simple mastectomy, which is the removal of the breast tissue, or a radical mastectomy, which is the removal of the breast tissue, including all of the lymph nodes that drain it. Remember, also know that in what is known as the anterior axillary fold, or that fold of skin that connects the breast to the upper limb, that also has breast tissue. That could be followed, these treatments could be followed by radiation or chemotherapy or a combination of both. There are also some newer drugs that are out there that are used to block the receptors that receive estrogen and other growth factors. So those are known as anti-estrogens. Okay, and in order to detect breast cancer early, you want to advise your patients to always do monthly self-exams. Okay, everybody is more familiar with their own breast tissue. Mammograms, annual mammograms. If there is a family history, they might have to start at an earlier age. And sometimes if the Um, in women that have a very strong family history of breast cancer, they could get genetic testing to find out if they carry that gene. So that about 5 to 10% of all of breast cancers are due to inherited tendencies. In the next part, we'll be discussing birth control.